Hello, this is Introduction to Pediatric History Taking. There are a difference between pediatric history and adult history taking. Difference of a pediatric history compared to an adult history include a content difference. The main content that is present in pediatric history that should be taken in pediatric history in addition to that of adult history include prenatal and birth history, developmental history, social history, environmental risks, and also immunization history. The second is parent as historian. As you know, young children do not give a history by themselves. So parents and the caretakers are an historian. So parents' interpretation of signs and symptoms might be different from what you expect and what must be. Children above the age of 4 might be able to provide some of their own history, and reliability of parents' observation varies. For example, only the caretaker might know the circumstance when something happens or the situation of a child, and a father may not know anything about the child. So if you take a history from someone who is not reliable, who doesn't know well about the child, it might be a different history from that knows the child very well. Adjust wording of a question. So for example, when did you first notice Pedassos was limping? Instead of when did Pedasso hip pain start? Most of the time they don't know when the hip pain starts. They know when the child starts to limp. So you should have to adjust how you ask a question. The other is observation of parent-child interaction. You should have to know the interaction of the parent and the child because that is very important in the overall health of a child. For example, distraction to parent may interfere with history taking. Quality of relationship should be identified. Is the father authoritarian? Is the father uh, giving a care for his child? And we should have to see the quality of relationship between them. The other is parental behavior and the emotions are important. For example, parental guilty. If you say, for example, if the child is unvaccinated and you ask them why, and they said because of some lack of awareness and something, and you said some negative or wrong thing, there might be guilty, so they might not give appropriate history next time. And always be non-judgmental. And the irritable parent, for example, the father might be irritable that the child is sick due to the carelessness of the mother and the ignorance of the mother. So the irritable parent might interpret the type of history they give and how we should have to take history. Overall, outline of the pediatric history include the first is identification. We should have to ask age, gender, race, and other important identifying information about the patient and from where they came, and also address and if important phone number because uh, this might be important to track the child, to track the patient. Initial assessment identifying the historian, that person's relationship to patient and their reliability. The second is previous admission, diagnosis, duration of stay, and the condition on discharge during previous admission. The third is chief complaint. This is a brief statement of primary problem, including the duration that caused family to seek medical attention. Next to chief complaint is history of present illness or HPI. This is a concise chronological account of the illness, starting from explaining the chief complaint, including any previous treatment with full description of symptoms, if it is pertinent, and should have to include pertinent positives and pertinent negatives to rule out potential differential diagnosis for that chief complaint. It belongs here if it is related to the differential diagnosis for the child complaint. For under 5, always include nutritional, immunization, and the sunlight exposure at the end of HPI. One is past medical history, major medical illness, major surgical illness, trauma, fractures and laceration, current medication, known allergies, immunization status. So if those things are important or if they are related to the chief complaint, we should have to take them to the HPI. If not, we should have to put under past medical history. The other is pregnancy and birth history. Maternal health during pregnancy, such as bleeding, trauma, hypertension, any infectious illness, medications, drugs, alcohol, smoking, and the duration of rupture of membrane. And also in addition to maternal health during pregnancy, you should have to ask gestational age at delivery if the child is young. Labor and delivery, length of labor, fetal distress, type of delivery, use of forceps, anesthesia, whether the baby cried immediately after birth, because those things might tell us the perinatal condition. And for example, if the child is distressed at birth or having perinatal asphyxia, he might develop as a complication, it might develop cerebral palsy. Neonatal periods, Apgar score, breathing problems, use of oxygen, any history of hyperbilirubinemia, birth injury, feeding problems, length of stay, and birth weight. The other is developmental history, age at which milestones were achieved, and the current developmental abilities. Age at which the child starts to have social smile, at which he starts to roll, at which he starts to support his head, sitting alone, crawling, walking, running, and when he said first word, and toilet training, and the extra. School is also important as a part of developmental history. Present grade, any specific problems and the interaction with peers. Behavior such as enuresis, temper tantrums, thumb sucking, pica, and the nightmares should be asked. The other is nutritional history, duration of breastfeeding, exclusive breastfeeding, duration of uh, total duration of breastfeeding in addition to complementary feeding, when complementary feeding was started, and when he started solid, and the amount it takes per day, and the type of food he eats per day, and for less than 5 years, whether he is sharing a dish with his siblings to know the underlying cause of malnutrition, for example. The other is family history, check for illness, any cardiac, any diabetes, any asthma, epilepsy, and the other chronic medical illnesses. Check for mental retardation, congenital anomalies, chromosomal problems, consanguinity, and the ethnic background of the family. We should have to also ask social history, living situation and the condition, housing, source of water, daycare, safety issues, and the occupation of parents. The other is review of system. Review of system is important to pick anything that we missed during history, usually very abbreviated for infants and young children. We should have to review each and every system, skin, lymph nodes, HNT, cardiac. We should have to check also respiratory issues, gastrointestinal, genitourinary, musculoskeletal, issue related to puberty, if the child is in pubertal age, any allergy. So we should have to ask important symptoms suggesting a problem in a specific uh, system to pick any missed issue during HPI. Thank you for watching. Next, we will discuss about physical examination.